aged cheese. What's the blue in the blue vein cheese? The blue in the blue vein cheese is mould. So the only cheeses that don't sit under that category, the cheeses that have probably a pH of 7 would be your fresh. So that's your cottage, your ricotta. I'm not saying that they are okay, because usually they come from cows who have not been fed right or have chemicals in them. But on the pH scale, they're not as acid.
Are you one of those people who just can't resist the sharp, savoury bite of aged cheese? Dairy products in general are often praised for their calcium and protein, and cheese especially is seen as a flavourful and satisfying option. But the truth is, not all cheese is as innocent as it looks. Especially when it comes to aged varieties, there are several hidden dangers that most people are completely unaware of. Research even shows that people who consume high amounts of cheese are more likely to experience elevated levels of saturated fat and sodium in their diet, which directly increases their risk of heart disease. And that's just the beginning. So, what exactly makes aged cheese so concerning? Why do experts warn about certain compounds that form during the aging process? And how can something that tastes so good be potentially harmful to your health? Keep watching as we break down the top dangers of aged cheese. Number 1. Foodborne pathogens in aged cheese. Aged cheeses can carry harmful bacteria that thrive in low moisture, salty, acidic environments. Listeria monocytogenes, Salmonella spp, and certain strains of Escherichia coli can persist through the aging process and cause serious illness. These microbes may enter cheese when raw milk is contaminated, or when equipment, aging rooms, and handling surfaces are not kept sterile. The aging process, or affinage, relies on precise control of temperature and humidity. Ideal conditions around 10 to 13 degrees and 75 to 95% relative humidity encourage helpful molds and bacteria to develop flavor. If cleaning slips, however, moisture on boards or dripping water can spread pathogens. Soft ripened cheeses such as brie and camembert pose extra risk because their higher moisture lets bacteria multiply faster. Blue vein cheeses like Roquefort and Gorgonzola form pockets where dangerous microbes can hide from surface cleaning. Several outbreaks highlight the danger. In 2010, an artisan creamery in the United States aged brie made from unpasteurized milk. Over 50 people across 5 states fell ill with listeriosis, 30 required hospitalization, and 3 pregnant women miscarried. A second outbreak in 2017 involved a small goat milk farm. Poor sanitation in the aging cellar allowed salmonella to spread. 80 people developed diarrhea and fever. In both cases, lapses in pasteurization checks and cleaning logs directly led to illness. When harmful bacteria enter the body, symptoms can vary. Listeria often has an incubation of 3 to 70 days. Initial signs include fever, muscle aches, headache, nausea, and diarrhea. Within days or weeks, it may invade the nervous system, causing stiff neck, confusion, loss of balance, or convulsions. In vulnerable groups, pregnant people, newborns, older adults, and those with weakened immune systems, infection can be life-threatening. E. coli, O157H7, and Salmonella tend to cause acute diarrhea, abdominal cramps, vomiting and fever within 1 to 3 days of exposure. In some cases, E. coli infections lead to hemolytic uremic syndrome, HUS, which can cause kidney failure. Salmonellosis can dehydrate the patient and, in severe cases, invade the bloodstream, requiring intravenous antibiotics and hospital care. To lower risk, choose cheeses made from pasteurized milk. Confirm pasteurization by reading labels. Store cheese at or below 4 degrees C in a clean crisper or sealed container. Change wrapping daily to prevent cross-contact with raw meats or produce. Use separate clean knives each time you cut cheese. Always wash hands before and after handling. When serving at gatherings, discard cheese that has sat out over 2 hours or 1 hour if room temperature exceeds 30 degrees. Number 2, high sodium content salt plays a key role in cheese aging. It slows spoilage, controls moisture, balances acidity, and builds flavor. Yet a single ounce, 28 g of cheddar can hold 150 to 200 milligallons of sodium. Blue cheeses often contain 300 to 350 milligallons per ounce. A standard snack of 2 ounces may supply 300–700 milligrams of sodium, which is 13 to 30% of the World Health Organization's 2,000 milligrams daily limit. Many people add cheese to sandwiches, salads, casseroles, and sauces. Over a day's meals, cheese's sodium stacks up quickly. For example, a cheeseburger with 2 ounces of cheddar, 400 milligrams, a slice of pizza, 500 milligrams, and a salad topped with half an ounce of blue cheese, 175 milligrams, yields more than 1,000 milligrams of sodium from cheese alone. Add in bread, condiments, and soups, and overall intake can exceed safe limits. High sodium intake is linked to higher blood pressure. When you consume excess sodium, the body retains water to dilute the excess ions. That extra fluid raises blood volume, increasing pressure on blood vessel walls. Over months and years, elevated pressure damages vessel linings, leading to artery stiffness, heart strain, stroke risk, and kidney injury. Some individuals are more salt sensitive. Factors such as age, genetics, ethnicity, and kidney function affect how strongly sodium impacts blood pressure. In salt-sensitive people, even small sodium increases can trigger noticeable rises in blood pressure. Those already diagnosed with hypertension, heart disease, or chronic kidney disease should aim for 1,500 milligrams of sodium or less daily per American Heart Association guidelines. To enjoy cheese while controlling sodium, try these steps. First, look for low sodium or lightly salted labels. Some producers rinse wheels in fresh water or brine solutions to wash away excess salt. Next, measure portions. Use a scale or measuring spoons to limit cheese to 1 ounce servings. Grating cheese into dishes spreads its flavor so you can use less. Third, swap in lower sodium alternatives. Fresh mozzarella contains around 40 milligrams per ounce. Swiss averages 54 milligrams, and part skim ricotta about 135 milligrams per ounce. Pair cheese with foods that help offset sodium's effect. Fresh fruits and raw vegetables provide potassium, which helps balance sodium in the body. Legumes, nuts, and seeds also supply minerals that support healthy blood pressure. Drink water throughout the day to assist kidney function. Finally, monitor overall sodium sources. Many processed foods, canned soups, deli meats, condiments, frozen dinners, and breads hide large amounts of salt. Track intake using a nutrition app or food diary to stay within safe limits. Number 3, saturated fat and dietary cholesterol. Aged cheeses are higher in fat than many fresh varieties. An ounce of mature cheddar contains about 9 grams of total fat, with 6 grams of saturated fat and around 30 milligrams of cholesterol. In comparison, 1 ounce of part skim mozzarella has about 4 grams of fat, with 2 grams of saturated fat and 15 milligrams of cholesterol. Frequent consumption of high-fat cheeses can shift your blood lipid profile toward levels that increase heart disease risk. When saturated fat enters the bloodstream, the liver may respond by producing more low-density lipoprotein, LDL, cholesterol. Elevated LDL can deposit on artery walls, forming plaques. Over years, these plaques narrow vessels, reducing blood flow to the heart and brain. That process raises the risk of heart attack and stroke. High dietary cholesterol can add to total blood cholesterol levels, though individual responses vary more than with saturated fat. On a 2,000 calorie diet, dietary guidelines recommend no more than 10% of calories from saturated fat, around 22 grams per day. A 2-ounce serving of aged cheese can provide 12 grams or more of saturated fat, covering over half the daily limit. If you add cheese to multiple meals, on toast for breakfast, in a sandwich at lunch, and as a snack, you can easily exceed healthy thresholds. High-fat cheeses also carry more calories. Fat supplies 9 calories per gram, compared to 4 calories per gram for protein and carbohydrates. A single ounce of cheddar has about 115 calories. Multiply that by multiple servings, and calorie intake climbs without a matching boost in fiber or micronutrients. Over time, excess calories can lead to weight gain. Obesity itself raises the chances of high blood pressure, type 2 diabetes, joint pain, and certain cancers. To balance cheese's taste with health, choose lower fat options when possible. Part skim or reduced fat versions of mozzarella, Gouda, and Swiss deliver creamy texture with less saturated fat. Fresh ricotta or cottage cheese also offer lower fat per serving. You can still use a bit of aged cheese for flavor, but spread it across multiple dishes so each serving stays small. Number 4, biogenic amines, histamine and tyramine. During cheese aging, bacteria break down proteins into smaller compounds called biogenic amines. Histamine and tyramine are 2 common byproducts. In small amounts, most people process these safely. But when levels climb, sensitive individuals may experience adverse reactions after eating aged cheese. Histamine forms when microbes decarboxylate the amino acid histidine. Ingested histamine can trigger headaches, flushing, itching, nasal congestion, stomach cramps, and diarrhea. People with histamine intolerance lack enough diamine oxidase, DAO, the enzyme that breaks down dietary histamine. Certain medications like non-steroidal anti-inflammatories, some antidepressants and heart medications can also block DAO activity, worsening reactions. Tyramine comes from tyrosine breakdown. It affects the nervous system by triggering the release of noradrenaline, which raises blood pressure. In most people, tyramine is rapidly deactivated by monoamine oxidase, MAO, enzymes in the gut and liver. However, individuals on MAO inhibitor, MAOI, medications used for depression or Parkinson's disease cannot break down tyramine effectively. Aged cheese can then lead to a cheese reaction, causing sudden hypertension, pounding headache, palpitations, sweating, and chest tightness. The level of histamine and tyramine varies by cheese type and age. Long-aged hard cheeses such as Parmesan, aged cheddar, Gouda, and Romano may contain hundreds of milligrams per kilogram. A 30-gram serving of aged Parmesan can have over 100 milligrams of histamine. In contrast, young cheeses, like fresh mozzarella, ricotta, and cream cheese, often contain less than 10 milligrams per kilogram. To reduce exposure, choose younger cheeses or varieties with shorter aging periods. Hard or semi-hard cheeses aged under 2 months typically contain lower histamine and tyramine levels. Keep cheese refrigerated at or below 4 degrees Celsius and finish opened packages within 3 days. Leftovers that sit longer allow biogenic amine levels to climb further. Number 5, mycotoxins and unwanted molds. Many cheeses rely on specific molds to develop texture and taste. Blue cheeses use Penicillium roqueforti, and bloomy rind styles like Brie and Camembert use Penicillium camemberti. Those molds are safe and tested for food use. Yet unwanted molds from raw materials, airflow, or unclean surfaces can introduce strains that produce toxic compounds known as mycotoxins. Ochratoxin A and Roquefortine C are 2 mycotoxins that can arise in dairy products. They withstand acid, heat, and salt, so they remain in cheese even after cooking. Animal studies link long-term exposure to ochratoxin A with kidney damage and weakened immunity. Roquefortine C has shown neurotoxic effects in lab tests. While direct human data is limited, regulatory agencies set strict limits on mycotoxin levels in cheese to protect health. Unwanted molds often appear as fuzzy spots that differ in color or texture from the intended rind. Black, green, pink, or yellow patches on cheese surfaces signal contamination. In soft cheeses, mold can spread quickly through the creamy interior. In hard cheeses, it grows more slowly but can extend deep under the rind. People with mold allergies face two risks. Eating moldy cheese may trigger digestive upset, but breathing airborne spores when slicing or handling moldy areas can cause respiratory symptoms: sneezing, runny nose, itchy eyes, or asthma attacks. Skin contact with moldy surfaces may lead to rashes or itching. To avoid unwanted molds and mycotoxins, buy cheese from reputable producers. Check expiration and lot numbers and look for certifications or lab tests if available. Store cheese in a clean, dry drawer or sealed container, away from damp or moldy items. Inspect cheese before eating. If you see mold that is not part of the cheese's design, cut at least 1 inch, 2.5 centimeters around and below the spot on hard cheeses, discarding the cut portion. Soft cheeses with mold outside their expected rind are best discarded entirely. Regularly clean your refrigerator and storage areas. Remove expired items and wipe shelves with a mild bleach solution or vinegar. Avoid storing cheese near raw meat or unwashed produce that may carry mold spores. Use fresh wrapping materials, wax paper, parchment, or plastic wrap each time you open a cheese package. For people with weakened immunity, severe allergies, or chronic lung conditions, avoiding aged cheeses altogether may be safest. Pasteurized, factory-tested fresh cheeses carry minimal mold risk. If you choose aged varieties, keep portions small, consume quickly after purchase, and store them properly. Number 6, allergens and lactose intolerance. Cheese contains milk proteins, casein and whey, that rank among the top 8 food allergens. Even a tiny crumb of cheese can trigger an allergic reaction in a sensitive person. Symptoms range from hives, itching and swelling to wheezing, abdominal pain, vomiting, and in severe cases, anaphylaxis. Anaphylaxis may include throat tightness, difficulty breathing, and a sudden drop in blood pressure. Without prompt treatment with epinephrine, it can be fatal. True dairy allergy differs from lactose intolerance. In lactose intolerance, the body lacks lactase, the enzyme that breaks down lactose. Aged cheese often contains less lactose than fresh cheese because bacteria consume much of it during ripening. Parmesan and aged cheddar may have under 1 gram of lactose per ounce. Yet small amounts of lactose can still cause gas, bloating, cramps, and diarrhea in highly intolerant individuals. Symptoms usually begin 30 minutes to 2 hours after eating. Allergic reactions involve the immune system. When someone with dairy allergy eats cheese, their immune system mistakes milk proteins for harmful invaders. This triggers release of histamine and other chemicals that cause allergy symptoms. Even pasteurized and aged cheeses carry intact proteins. Heating or aging does not destroy the allergens. Labels rarely distinguish between high-risk aged cheeses and low-risk fresh varieties. Cross-contact during production can add risk. If a facility also handles tree nuts, soy, or wheat, trace amounts may end up in cheese. Those traces can provoke reactions in people allergic to those other foods. While most large producers follow strict cleaning protocols, smaller farms or farms that share equipment pose higher cross-contact risk. Always check labels for may contain warnings and contact the producer if you are unsure. People with either dairy allergy or severe lactose intolerance should avoid aged cheese entirely. For milder lactose intolerance, some may tolerate small servings of long-aged, hard cheeses. Keeping portions under 1 ounce and pairing cheese with other foods can slow digestion and reduce symptoms. Lactase enzyme supplements taken before eating may help some people digest residual lactose. However, those with true dairy allergy must not rely on supplements. When dining out or buying specialty cheeses, inform staff of your allergy or intolerance. Ask detailed questions about ingredients and cross-contact practices. In social settings, avoid sharing platters or utensils that may have touched cheese. Carry an epinephrine auto-injector if you have a history of anaphylaxis. Always read product labels and choose brands that clearly list allergens and manufacturing processes. Number 7, hormonal and antibiotic residues. Modern dairy farms sometimes use hormones and antibiotics to boost milk yield and treat sick cows. Bovine somatotropin, RBST, is a synthetic growth hormone given to some dairy cows to increase milk production. While many countries ban its use, it remains in others. Tiny traces of RBST or its byproducts can remain in milk fat. Aged cheese, with its high fat content, may concentrate such residues. Consumers then ingest those residues over time. Antibiotics are routinely used to treat mastitis and other infections in dairy herds. Farmers follow strict withdrawal times, periods during which milk must be discarded after treatment to prevent residues from entering the food supply. Yet lapses can occur. If a cow is treated and its milk enters a bulk tank too soon, antibiotic traces can persist in the final cheese. Aging does not fully degrade many antibiotic compounds. Hormonal residues may act as endocrine disruptors. Some studies link synthetic hormones to altered hormone levels in humans. Over years, even low-level exposure may affect reproductive health and increase cancer risk, especially in vulnerable groups such as children or people with hormone-sensitive conditions. Evidence remains mixed, but many consumers prefer to avoid any exposure. Antibiotic residues pose two main concerns. First, residues can trigger allergic reactions in sensitive individuals. Even tiny amounts may cause skin rashes, breathing problems, or anaphylaxis. Second, low-dose antibiotics in food may promote antibiotic resistance. When gut bacteria encounter antibiotic residues regularly, they can develop or share resistance genes. Those resistant bacteria may then cause infections that are harder to treat. To reduce exposure, choose dairy-labeled RBST-free, hormone-free, or organic. Organic standards prohibit synthetic hormones and require strict antibiotic withdrawal protocols. Look for certified organic seals or third-party verifications. If organic cheese is unavailable, seek out small dairies that post testing results or follow transparent antibiotic use policies. Number 8, environmental contaminants and heavy metals. Cheese begins as milk, and milk reflects what cows eat and what water they drink. Industrial pollutants, heavy metals, pesticides, and persistent organic pollutants, POPs, can enter pasture grasses or feed grains. Water sources can carry lead, cadmium, or mercury. These toxins accumulate in cow tissues and milk fat. During cheese production, fat concentrates. As a result, aged cheese may contain higher levels of certain contaminants than the original milk. Lead often contaminates soil from past industrial activity, old paint, or contaminated water pipes. Cows grazing on such soil may ingest lead particles along with grasses. Lead accumulates in fatty tissues and is excreted into milk. Consuming lead over time harms the nervous system, especially in children. It can cause developmental delays, learning difficulties, and lower IQ scores. In adults, lead exposure may raise blood pressure and impair kidney function. Cadmium enters ecosystems through phosphate fertilizers, industrial discharges, and vehicle emissions. It concentrates in soil and water, then moves into plants. Cows feeding on those plants pass cadmium into milk. Chronic cadmium intake damages kidneys and may cause bone weakness. It is classified as a human carcinogen linked to lung and prostate cancer when levels are high. Mercury, notably methylmercury, accumulates in aquatic food chains but also reaches farmland via atmospheric deposition. Rainfall washes dissolved mercury into waterways that supply farm irrigation. Crops and grasses absorb methylmercury, entering the cow's diet. Mercury exposure mainly affects the brain and nervous system, with symptoms like tremors, memory problems, and vision or hearing impairment over time. Pregnant women and young children face higher risks. Other pollutants include dioxins, PCBs, and pesticide residues. These fat-soluble compounds resist breakdown. They concentrate in milk fats and aged cheeses. Long-term, they may disrupt hormones, impair immunity, and raise cancer risk. Although regulatory agencies set maximum allowable limits, occasional lapses in monitoring or enforcement can occur, especially in regions with less stringent oversight. To limit exposure, choose cheeses from regions with strong environmental regulations. European Union countries and parts of North America typically test dairy products for heavy metals and POPs. Look for producer transparency. Some farms publish test results for soil, water, and milk. Certified organic labels also imply lower pesticide residue levels, though they do not guarantee zero heavy metals. If you still enjoy cheese, that's okay. The key is awareness and moderation. Make smarter choices, read labels, and always listen to how your body reacts. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs to hear this. And as always, take care of yourself. Your body will thank you for it.